Hello, everyone. My name is Annie Rogers, and on behalf of the Attitude team, I'm so pleased to welcome you to today's ADHD Experts presentation titled ADHD in the African American Community, Strategies to Improve Care and Treatment. Leading today's presentation is Dr. Cheryl Hamilton. Dr. Hamilton is the founder and executive director of Hamilton Counseling and Consulting in Duncanville, Texas. She's been in private practice since 2014 and specializes in play therapy, adolescent, youth, and career counseling. In today's webinar, we will begin to understand the many ways that myths and barriers to care impact ADHD treatment outcomes in the African American community. Dr. Hamilton will help us understand bias, reduce shame, and use strategies that align with the cultural beliefs and values of minority families. We'd like to begin today's webinar by asking a poll question to our live audience. What cultural misconception or stigma about ADHD has had the biggest impact on you, your family, your students, or your professional practice? Please use the text box under the video player to give us some insight. And for answers to common webinar questions about slides and transcripts and certificates of attendance, please know you can click on the FAQ tab of your webinar screen. If you're listening in replay or podcast mode, visit attitudemag.com and search podcast 462 to access webinar resources. If you support the work we're doing here at Attitude to strengthen the ADHD community, we encourage you to visit attitudemag.com/subscribe and sign up to receive Attitude Magazine. You can get it for yourself or to share with a teacher or a loved one who could benefit from greater ADHD understanding. You can click on the magazine tab on your screen to learn more. Finally, we have a sponsor today, and that is Inflow. Inflow is the #1 app to help you manage your ADHD. Developed by leading clinicians, Inflow is a science-based self-help program based on the principles of cognitive behavioral therapy. Join Inflow today to better understand and manage your ADHD. You can click the link on your screen to learn more. Attitude thanks our sponsors for supporting our webinars, and sponsorship has no influence on speaker selection or webinar content. So without any further ado, I'm so pleased to welcome Dr. Cheryl Hamilton. Thank you so much for joining us today and for leading this really important discussion.
All right. Hello, everyone, and thank you again for joining us. I am so excited that I was invited to do this topic. And actually, after reviewing all of the questions that came in on last night, I definitely am clearly aware that this topic is very prevalent and our community is definitely needed. And so I just want to dive right in and get started. So our learning objectives for today is to identify cultural misconceptions and stigmas surrounding ADHD within the African American community. We would like to demonstrate an understanding of culturally competent strategies utilizing psychoeducation to desensitize myths of ADHD. And we would like to apply evidence-based practices in different settings. So in the beginning, I was trying to figure out what was the best way to kind of start this off, because I know that a lot of people have questions about, like, how do I get help? Where do I start? And I know we have a broad audience of providers and parents and educators and other people who are just interested in this topic. So I thought the best way was definitely to provide us with some cultural awareness and then help us to understand our cultural responsibility by just diving in and focusing on those historical dissimulations and systemic racisms that African American has faced within America and across the nation, you know, but especially the ones that correlate with ADHD. And so one of the ones that we have definitely not heard a lot about, but it is becoming a little bit more clear, is the cloning of Henrietta's lax cells, the Tuskegee syphilis experiment. And then also when we focus on systemic racism, we're looking at the school to prison pipeline. And so we're going to go over just two of those due to time. One of them, which has definitely had profound evidence that correlates ADHD with the mindset and the myths and the disbeliefs of African Americans. And so we want to start with the Tuskegee syphilis experiment. So this experiment created such a worldwide view and awareness of racism and injustice towards African Americans. I think this was definitely one of the first ones that was brought to our attentions, where we saw how African Americans was viewed as non-human, but also treated in such an inhumane way. And so just to kind of give you an overview of what happened, in 1932, the Tuskegee syphilis experiment began. And it was definitely where a group of doctors and scientists decided, hey, let's get together. And I'm just going to give it to you in a general way. Let's get together and we're going to definitely test African American males. And what we want to do is we want to get this, and we're going to see it as an observational experiment, more of something that's in nature. We just want to know, like, how does their blood work? If we give them this medication, how will it affect them? And so around 1940 actually is when they starting the procedures and doing the experiment. But 399 African-American men were diagnosed with syphilis, and 201 were unaffected men, and they served as the controlled group. The study's physicians contacted other doctors in the area and said, hey, if these men are a part of this program, please do not treat them. And so that actually created the first it's part of where African Americans started the distrust, how we don't trust the medical providers in the field, as well as how we became very skeptical about what Americans had to say about African Americans. During this experiment, and I want you to know this experiment lasted 40 years. During this experiment, participants were only offered free medical exams, free meals on examination days. They were offered transportation to and from the clinics, and chillingly, they were offered stipends for burials to their loved ones, for the ones who passed away and the ones who had survived. So again, this study was intended to last only 6 months, but was extended for several years, all the way up to 40 years. And that's a long time to actually test someone and not helping them understand what they're being treated for, and letting them know that they were going through an experiment. And so some of the things that they actually were told was that they were being treated for bad blood, which was one of the things that, for the African American men who was going through the study, they were under the impression that there was something wrong with them. So they was fed a lie. And that's why we call it a cultural dissimulation, because it was something it was a cover up. It wasn't the truth, In 1973, a class action suit was filed, and survivors received medical benefits. And so it took from 1932 all the way to 1973 for one of them to say, you know what, there's a problem. Something is wrong with this. And then in 1975, Americans started looking at it as a true problem, and they created what is called the Tuskegee Health Benefit Program. And it also allowed the participants' wives, widows, and children, and they were all added after 1975. But it took almost 40 years for those males to get an apology. And in 1997, President Clinton issued a formal presidential apology to these participants. So that is actually one of the historical dissimulations that happened to African Americans, where we have definitely kept that idea of, wait a minute, what if this is incorrect? What if I'm being treated wrong? And what if I'm going through an experiment that I'm unaware of? So when we look at the next systemic racism program that was created, we look at what is called the school to prison pipeline. And the school to prison pipeline is the process of using discipline procedures, practices, and policies that typically result in students of color ending up in the criminal justice system. Some of you may have heard of the zero tolerance policy, and we probably practice that in schools throughout America. That definitely is incorporated within the school to prison pipeline. And so that is where school disciplinary policies are disproportionately affect Black students. Black students represent 31% of school-related arrests, and then Black students are suspended and expelled 3 times more than other ethnicities. And so when you think about that and you think about all of the things that actually have been created, then it kind of gives you an idea of why there are so many different cultural misconceptions as well as cultural stigmas that exist for African Americans, especially when it comes to ADHD, because number one, it's kind of hard for people to wrap their mind around what ADHD is. And we've heard about so many different things that it could or could not be, and there's so many different myths that are attached to it. So I wanted to just kind of point these 2 things out, because these 2 events have actually been correlated to ADHD when we're focusing on our youth as well as adults. So just moving on, we want to kind of look at what is cultural misconception. And so we have cultural misconception, and then we have cultural stigma. So cultural misconception is definitely a view or incorrect opinion based on faulty thinking or understanding relating to a society's ideas, customs, and social behaviors. And so these are things where people who are not within the culture already feel like they have maybe an idea of what that person is experiencing. Maybe they feel like they know those social behaviors. Those are those small microaggressions that are sometimes placed on a person based on what you believe, or those judgmental or biases things that you have thought of, or maybe you've witnessed on TV, or maybe you've heard other people say negative things about African Americans. Those are the cultural misconceptions. So maybe not identifying exactly what is the truth, but going based on your opinion or based on faulty thinking or understanding related to society's ideas, customs, and social behaviors. And then we have cultural stigma. The assumption is that an individual's behavior is affected by the culture of the societies to which they belong. So cultural stigma look at it and say, okay, so they're African American, so they must be this, or because they're African American, they act this way, or because they're African American, then they only can reach this level of education, or this level within their career, or this level within on a job. And so those are cultural stigmas. Those are often placed on African Americans even before you meet the person in particular, or even before you know what that person possess or come to the table with, as we say. And so we want to think about, like, how does all of these things that we've discussed so far, how does those things actually affect African Americans and the providers who are trying to provide service for them when we focus on ADHD? So moving on. Common cultural stigmas within the African American community look like this: fear of being labeled, parental shame and disbelief, not viewed as normal, and then inaccurate diagnosis. And once you kind of let that all sink in, then you'll see that it's kind of actually hard for a parent or for an individual adult to take their child or take them on themselves to a doctor to say, you know what, I think there's something going on with me, because they're already fear of being labeled. They don't want any extra diagnosis. We don't even want a diagnosis. We don't want to be viewed as crazy or being viewed with a mental health disability. And so it's hard for us to accept labels. And definitely it comes from cultural the historical dissimulations that has already occurred. The parental shame and disbelief we're definitely going to talk about, but that is actually a thing with African Americans that comes from just thinking, okay, is this something that I have created in my child? Is this something wrong with my child? Why is my child experiencing these things? Those are the parental shames and disbeliefs that often parents have when we're looking at focusing on our children and the possibility of them having or experiencing symptoms of ADHD, and then not viewed as normal. For African Americans, we're already walking around with a lot of systemic trauma that we face. And so the last thing that we definitely want to be labeled as not normal. We want to make sure that we are this upstanding citizens. We want to make sure that people view us in a different light. And we're already facing all of those other unconscious biases and those microaggressions that continue to face us daily. And so one of the things that we try to do is not be labeled with anything or not be viewed as normal. And so this right here creates us from preventing different things or accepting. It creates us not accepting what is in front of us. And oftentimes that may be the ADHD diagnosis. And then the inaccurate diagnosis, so oftentimes children who have been diagnosed with ADHD before they were diagnosed with ADHD, they probably was diagnosed with oppositional defiant disorder, conduct disorder, and sometimes emotional disturbance disorder. And so when considering all those things, African Americans experience a lot way before we actually get to the right diagnosis. Going back to the parental shame versus the child shame, when you look from a parental mindset, we look at what is wrong with my child, as I stated before. Why is this happening to my child? We want to know, where did this come from? How did this happen? Where did my child get this from? And then last but not least, because we are one of those groups of people who want to fix things, we're trying to figure out, how do I fix my child? And sometimes providers may not see that because of all of the other things that we're facing. They may not be able to see that we do want to work with the provider. We do want to work with the teacher. But how do I get help? How do I fix my child? But I first got to change my parental mindset. From a child's perspective, we're trying to figure out, what is wrong with the child is often asking themselves, what is wrong with me? And so now that creates a lot of shame. Why am I like this? Why do others treat me like this? So there's definitely a lot of abandonment. There's a lot of shame. There's rejection. And then that creates low self-worth, low self-esteem. So when we kind of focus on the parent's conceptualization of the child's behavior, it all equals shame. And so we go back to, he seemed very out of control. It was not normal that day. I didn't have this problem with my other children. I was embarrassed because he did those things. I don't want to feel that he needs help. These are some different things that parents have said that definitely will create that type of shame, which will lead them to not getting the help that they need. And so sometimes they do come up with different statements or different ideas or a different mindset that this is something that's temporary and is going to go away. So maybe it just happened for that day, but eventually they're going to grow out of it. We won't have to be faced with this any longer. And then we have the parental concerns. One of the things that keeps parents from actually obtaining a diagnosis or even ruling out a diagnosis, because again, sometimes I want to say majority of the times, there's definitely inaccurate diagnosis of ADHD. And so parents are definitely concerned about treatment, the first thing that a lot of people throw out is medication, and that's something that we are definitely concerned about. Lack of finances or health insurance. Sometimes parents don't have the money to obtain the right diagnosis, and so they say, why even go through the process, even if the process is going to be good for my child, or maybe yield different results or help him in his education. Why am I going through this? And so they refuse services for that reason as well. And then a lot of times they don't prefer medication, linking back to the Tuskegee syphilis experiment. They don't want anyone to inaccurately diagnose or view them as there's something wrong with them. And then there's a certain level of unawareness about the medication. And then the negative expectations about treatment. Sometimes when they walk in the door, parents already have a negative expectation about the treatment because they haven't been educated about what ADHD is and what treatments do exist. And that's very important. And so we're definitely going to get right into that. And so moving on into the strategies, because I know that is what you all are here for, I created what I called a GROW checklist. And through this GROW checklist, it definitely helps us to kind of figure out how to, number one, treat our clients if you are a provider, how to work with our students if you're an educator, and if you are a parent, the GROW checklist is how to advocate for your child. But if you are an adult, how to advocate for yourself. So I created this GROW checklist, which means gain the understanding. You definitely have to understand the history of ADHD. You have to understand the history of the client, and you have to understand the support system. And so for African Americans, the support system definitely looks totally different. It's not just that immediate family who's making decisions, and we're going to talk about that in a few minutes, but it's other things and other circumstances and other people that are involved. We want to recognize the biases and the myths. We got to recognize the need for multicultural training, recognize the need for self-assessment, and then recognize the need for psychoeducation. And that's definitely, if you are a provider or an educator, you definitely want to recognize that sometimes maybe I'm not really fully aware of the experiences that this culture goes through. So I need to try to get some type of multicultural training to gain an understanding. And then doing a self-assessment, in which we'll definitely talk about in a few minutes. Then we want to operate differently. What worked for others may not work for this community right here. And see, we want to make sure that we utilize different cultural sensitive assessments. So there are some assessments that are better, and I'll give you a list of those, but then there are some that does not render accurate diagnosis. We want to create different treatment plans from a holistic perspective. And then we want to provide different strategies. So operating differently definitely creates a higher level of thinking and a higher level of awareness, where you have to definitely go out and collaborate with others. And then last but not least, we want to work within our scope of services, work through an integrative model, work with others through consultation. And then if that's not possible, we definitely want to work and refer. So we want to make sure that if we're not able to provide the best services for this client, then we want to make sure that we send them with a referral, or we help them locate the person who can help them with whatever they're experiencing. When you're working with parents, it's important that we reduce the shame and disbelief. So we want to build a trusting relationship, right? We want to walk in, and that's first and foremost. In order to work within the African community, we have to be able to trust that you have our best interests at heart. And so we want to work within building that trusting relationship. We want to provide psychoeducation and awareness. And this is for if you're a case manager, if you're a provider, and if you're a teacher. We want to make sure that we are able to provide the parents with awareness about what ADHD is. How can we assist them in this? What are their options? We want to help clients reduce cycles of blame, hopelessness, or self-defeating behaviors. And that definitely is important. And that leads me to create a buy-in atmosphere. If the parents don't believe that there's something wrong with their child, then they're definitely not going to continue to seek services. But a lot of times that disbelief comes from the cycles of blame, hopelessness, and those self-defeating purposes. So it leads them down a different path where maybe the child is not getting any help, any services at school, nor from providers in the community. Okay. So when working with African Americans, we want to look at an ecological system theory. And so we want to look at the child first, the immediate family, extended family, religious leaders, school, and community. So all of these things play definitely a part when working with African Americans, especially when working with the children. We have what we call a great spiritual background, where we're going to seek help first from our spiritual advisors, from church, from our pastors. We're going to ask those questions, especially if you have a client who is heavily involved in a religious organization. They're going to seek help from their religious leaders. So if that's the pastor, if that's the reverend, whatever ministry that they're associated with, the youth pastor, whoever, we're going to ask them, what do they think about this? So we're going to seek help from them first. And that's a lot of times. We're also going to talk to immediate family and sometimes extended family. And just understanding who extended family is very important. Extended family could be somebody who is blood related or non-blood related to them. So it definitely can have a bloodline where those are your cousins, your uncles, your grandparents. But then we also have where those are our best friends, the godparents, or whoever. That's considered extended family. We're seeking advice from them, but also that's our support system. So that's important to understand as well. We're going to find somebody in the school who we trust and we have a trusting relationship with. So it's better for us to build that relationship in the school system where we know that they have our back versus us dealing with someone maybe who only calls with negative information about our child or never finding anything positive. We want to find somebody who has something where we're able to see a little bit of hope. And then if our children are connected in the community, we seek advice from coaches, we seek advice from tutors. So whoever is within the community that our children are connected with, we're seeking advice. And so always know that African Americans are continuously trying to seek advice, but there has to be a relationship in order for us to trust what those people are saying and providing. So as a provider, there are definitely different things that you can kind of focus on, or as an educator, as a case manager, whatever area of field that you're working on, there are different things that we can focus on to kind of help within the African American culture. The first thing we need to do is focus on our unconscious bias. This is not being aware of when one is making judgments or decisions based on prior experience, deep-seated thought patterns, assumptions, or interpretations. Unconscious bias leads to a lot of things. What we have found that if it's provider unconscious bias, it leads to the inaccurate diagnosis. So as I was mentioning earlier, sometimes children have been diagnosed with ADHD later on in life, but prior to, they were diagnosed with oppositional defiant disorder. They were diagnosed with conduct disorder. This has led to higher rates of school suspension, less instructional time, higher rates of arrest. And then it also leads to a mental health care desert in our communities where people are afraid or maybe not willing to work within that community because they have this unconscious bias. And then there's inadequate treatment. And so that looks definitely like where you have a parent, you've diagnosed their child with ADHD, but you didn't provide any psychoeducation. You just threw them on some medication. There was no follow-up, and there's only like every 30 days they come back and get a prescription, but they still don't have strategies to help at home. And there was definitely no awareness of how things could definitely get better. When diagnosing, we definitely want to try to use culturally competent assessments. That is definitely important with helping within this culture. And so that starts with the cultural competent questionnaire. We want to use the DIVA, the diagnostic interview for ADHD in adults, if we're working with adults. We want to do a psychosocial assessment, the CFI, which can definitely be found in the DSM-5 for the cultural formulation interview. The Vanderbilt assessment scale has been linked, has yielded a lot of great reliable information. It has high validity to show that the Vanderbilt definitely can be utilized to help diagnose African Americans. And then we want to try to use an executive function assessment when working with them, because sometimes the executive function definitely has a lot to do with one who's having ADHD and then helping them with those symptoms. Other culturally competent strategies include psychoeducation, case management, nutrition management, training programs, physical health and wellness. Cultural competency also includes the medication, psychotherapy. So we want to use CBT. We want to use motivational interviewing. If you're a therapist, we want to use mindfulness, definitely art therapy, maybe also utilizing ADHD coaching. But going back to our spiritual connection, we want to do biblical counseling. This is definitely not offered in all communities, but it's something that we can, as providers, assist with, and that's the neurotherapy and then interactive metronome. And so that actually concludes some of my presentation, but I definitely wanted to go over some of the other things that I wanted us to remember. Again, we have to use some type of education and awareness that's going to be important to help others realize how to work with African Americans surrounding this topic, but also just promoting cultural responsibility, cultural awareness. And then we need to try to challenge those stereotypes and biases by promoting positive representation of African Americans in the media, in the arts, in entertainment, but also encouraging diverse voices and perspectives, when we're focusing on working with ADHD in the African American community.
Wonderful. Thank you so much, Dr. Hamilton. We're going to launch into the Q&A, but first, I just wanted to quickly thank our sponsor once more. Inflow is sponsoring today's webinar, and I'm going to circle back briefly to the poll question that we asked at the beginning, because it raised an issue that I wanted to start out with, and that is a number of people said that the greatest myth or stereotype preventing their own care or the care of their family members was actually around specifically being a girl or a woman who is African American with ADHD. And I wondered if you could just talk to a little bit about the unique barriers that African American girls and women face to getting an ADHD diagnosis and the treatment that they need.
Absolutely. So statistics have definitely shown that girls and women have a decrease. There's a decrease in diagnosis for them for one of the reasons, because they are not as hyper or they're inactive, so ADHD definitely comes with a label of being hyperactive and hyper impulsive. And so for girls, especially within that maybe third to fifth grade range, there has been evidence that's shown that they often get left behind because maybe they are inattentive, but they're not creating a lot of problems within the school or within the workforce for women. And then they're able to kind of maneuver around certain things. So people often label them as shy, maybe withdrawn, also depressed, but there's definitely a lack of diagnosis because the hyper activity is not present.
Right. And so that kind of goes back to the point you were making, that one of the big barriers is receiving a wrong diagnosis prior to the ADHD. So you talked a little bit about getting diagnosed with like oppositional defiant disorder or conduct disorder even, but for girls, perhaps it's that they're being diagnosed with depression or anxiety. And that I would imagine just really elevates the level of distrust.
Yes, definitely. It not only elevates the level of distrust, but if you can imagine somebody being given depression and anxiety medication over a long length of time and actually coming to find out that they actually didn't have depression or anxiety, but they were dealing with ADHD. And I think that's a lot of times what happens for girls as they get older and, you know, they become women and they get in the workforce, they start noticing that there are some things that that they are struggling with, you know, maybe just the withdrawal symptoms and other symptoms as such, but it's hard for them to maybe agree with the ADHD diagnosis at an older age because that was something that was skipped. So then it's harder for them to believe that they do have ADHD.
Right. You begin to doubt even yourself. So this does kind of dovetail with one of the other survey results we got. And it was more for boys, but they said the biggest myth or misconception was that their kids are just bad. That they're just bad kids, or that they're just choosing to act out. And so one of the questions that we received from a parent was what they can do when they see that their educators, their child's teacher is not offering equal treatment in the class. That they're not supporting their child in the way that they feel is appropriate. How can they better advocate with for their child and kind of build those that buy-in atmosphere that you spoke about?
Okay, so, and that's a very good question. I'm glad they asked because, again, just going back to that systemic racism with the school to prison pipeline and how often our young males are diagnosed with emotional disturbance disorder or even the oppositional defiant disorder and conduct disorder. This right here definitely is one of those things that leave a great concern for parents in getting their sons diagnosed in the first place. But I want to say we definitely want to start off with education and awareness. Sometimes we have to educate our teachers, and we have to educate them in a different way when it comes to discussing our children. So we have to start off with a positive light. And let me just go back. We have to educate ourselves about some of the symptoms that we have noticed, you know, so being open to see, okay, something is definitely going on, maybe even journaling and writing down the things that you have noticed or the things that you have seen your son experience and say, okay, maybe it's time for me to start creating a journal so that I can share this or maybe even talk to the doctor about it. So educating ourselves first and then educating teachers in the educational system and about what you have noticed. it's okay to share personal experiences. Sometimes we try to hide all of that. Again, going back to not being viewed as normal. So we don't want to talk about things that we feel that other parents may not be going through, especially to a teacher. We want our teachers to look at our children as if they're just as bright as the next child. And so we don't want to put any labels on them, going backwards. And so being okay to share those personal experiences about things that's going on at home. I know when I'm working with a lot of parents in my office, a lot of times they'll say, well, I didn't notice that. No, that's never happened. And so sometimes I have to go through one of those cultural sensitive assessments, and I have to say, okay, what about these times? So I have to spend a little bit more time with the parents, or even send them away with a questionnaire that shows, and say, okay, I want you to look at this week. I want you to kind of, pay attention to these things and see if this is happening when he's with you versus what he's doing at school. I would also say seek professional opinion. Again, we seek things from our extended family, from our friends, from our spiritual advisors, our coaches, but seek professional experience. Find someone who is fluent in ADHD, who knows what's going on, and talk to them about the situation and let them help you gain some perspective and process, all of the questions and things that you're experiencing. And then last but not least, just try to connect with support networks. And so and I'm not being paid for this, but CHAD is a great organization that has a lot of resources for parents, for professionals, and they are definitely promoters of ADHD. They even have a parent-to-parent class where you can take that help you as a parent understand maybe what ADHD is and what your child is going through. And then there are support systems in each state, different chapters. And if there's not a chapter in your area, you can get involved and start a chapter, but being aware of everything helps you to better advocate for your child.
Absolutely. And, we did receive kind of a question on the flip side to this from a teacher. And she wrote in looking for advice on how to have conversations with families to address some of the negative mindsets around what their child should be able to do when it's actually an area negatively impacted by ADHD. So expectation setting and understanding what symptoms are. And she writes in, I'm white, and I know that Black families have a lot of reasons not to trust me initially. They're justified in their concerns that I'm biased. Mm-hmm. How can I better communicate? Or are there resources that I can point them to that would perhaps be more trusted?
Great question. So as an educator and definitely as a non-African American educator, I know sometimes things can be difficult. And this conversation is a very difficult conversation. And so we want to, when conversing with African American parents, we want to make sure that they are aware that we are an ally, that we're there, we're standing with them in the gap. We want to make sure that we, number one, build that trust and relationship. That's most important. I did a study a couple of years ago about ADHD in the classroom and how teacher training can improve self-efficacy for the teacher. And so what was found is that when teachers are unaware of the different aspects or the different elements of ADHD, it decreases their self-efficacy, which means that sometimes they may have imposter syndrome about what's going on with the student. And so they have to first confront their biases, their unconscious biases that they may have in order to help that child get the services that they need. And so if you're not comfortable with talking about it, and especially not talking about it with an African-American parent, then maybe starting, I'm going to say the same thing, like educating yourself, getting that teacher training, even just participating in things like this so that you can become aware of all of the cultural biases and all of the misconceptions and stigma helps you be able to have that conversation. And then finding that person within the school that parent has a relationship with, whether it's the PTA president, whether it's the school counselor, whether it's the principal, the secretary, whoever it is, finding that particular person to say, hey, I'm struggling with this parent and I really want some help. I want them to know that I'm on their side. And here are some things that I have identified. How can we help this parent see that, this is not a negative situation and this child can overcome this. But first, we need to take these steps to do it.
Yes. I have to say that, so Attitude Magazine, we are sending our fall issue to the printer today. And in that issue, subscribers, you will find that we did a survey of more than 300 educators and asked them about training specifically on ADHD. Now, we did not touch on ADHD and race, but we found that about 100% of them said they taught kids with ADHD, and 40% of them had received no formal training on teaching kids with ADHD. And the vast majority, something like 75%, said they get most of their information just on their own, just seeking out books and magazines, we hope Attitude, and webinars like this one. But it really just shows that the resources that we as parents might assume that educators have are really lacking, and even more so in understanding how implicit bias and racism may factor in. So it's such an important point for everyone to understand that there is inadequate understanding of ADHD on many levels. So not a question, but just just piping in. Okay, so we do have also some questions about implicit bias in the healthcare realm, and some parents who have encountered basically dismissive clinicians. They're saying it's the subtle racism and unconscious bias that infuriates me. And I feel like as a parent, I'm being seen as too sensitive or overreaching. How can I express my concerns without being dismissed, specifically to my child's healthcare provider?
That is a great question as well. And unfortunately, what I'm going to say is find another provider who you trust and who does not dismiss what you're saying, and not seeing you as just being overly sensitive. You know your child better than anybody else does. And so, number one, we want to believe that there is some justice in the healthcare field. But the truth of the matter is there's still injustice everywhere, especially for African Americans. And so what I want to say is get a second opinion, and sometimes that means making sacrifices. I mean, it may not be, that might be the closest provider in your area. And I know it's easier said than done, but sometimes that means finding somebody who may be a little bit further out, because what you're seeing is real. You've probably done the research, you've done the study, and you're like, no, there's something definitely going on with my child. It is okay for you to say, you know what, I'm just going to get another provider who not only understands ADHD, but who understands African Americans who have or who are struggling with ADHD, a provider who is willing to sit down and do consultation and listen to my concerns, a provider who is willing to do accurate diagnosis using the correct assessments, a provider who is sensitive to your needs and your culture and all of the things that you are experiencing, not only as a parent, but as an African American parent. And so I know that answer was definitely maybe not the one that was the best, but I feel like sometimes we try to continue to go to the same provider, and we try to say, hey, I'm coming to you because these are my concerns, but maybe it's time to seek other help, seeking an ADHD coach, going a different way around this.
Right. You can't force people to hear you. We had just an interesting comment from one of our participants here today, who said that she's the parent of a Black child. She was worried initially when he started school that he would be labeled unfairly with an ADHD diagnosis. She said continually they said he had no problems, but quote, the truth was that subconscious assumptions drove them to hold him to a lower standard. And those lower expectations mean they didn't assume that he should have a diagnosis. So they basically missed his ADHD because of these lower standards. Is that something that you have seen, and any advice to parents who fear that they're facing the same?
Absolutely. I've not only seen that with ADHD, I've seen that with autism more recently. There's not a high level of expectation that comes from educators, especially after they have been made aware that there are things going on. And so oftentimes by the time parents get to my office, they're struggling with, students who their child who may have a lot of low self-esteem, low self-worth, and at that point may be developmentally behind because, they were only giving them certain things just to appease the child, or maybe just for the teacher to have some type of classroom management. And so I'm going to say with this, I'm just going back to what I said earlier, like, your child better than anyone does, and their capabilities and what they are able to do, their capabilities. And so advocate for your child. There are different processes in place within the school system that requires them to do what they're supposed to do, and that is to teach your child. And even if your child has not been labeled with ADHD, that there's something going on, and so you have to, for the parent, it comes with great sacrifices, advocating, being aware, stopping things that you have noticed to be microaggressions, and making sure that the teachers and the administrators are educated and have the information that allows them to see your child for who your child truly is.
Absolutely. There are a number of questions kind of on the other side here, with a number of people writing in to say that their child is being threatened with expulsion, or that they're being excluded from the classroom, kind of off the books expulsions. And they really feel like they don't have an ally in the school system, and that they're seeing like this school to prison pipeline, take shape in front of their eyes. How can parents stop this in its tracks and help their kids get the services they need instead of this, undue punishment? And how serious is this problem?
So I'm going to give the suggestion let me start with how serious this problem. This is a huge problem that we're facing right now, especially post-COVID. I have seen more children who have been expelled from school, I've seen 6 and 7-year-olds who have been put out for the year and have told they can come back next year because legally in Texas, you don't have to be in school until you're 7, to the age of 7. It has really gotten out of control within the school system. And part of that is because, again, there has been no training in working with children with ADHD within the school system, but also it's because there's a lot of different emotional factors that are occurring after COVID. And so because of that, school systems are creating a path where kids are not even wanting to be within the school, not even wanting to learn. They're creating environments where children are just saying, you know what, I don't even want to go to school anymore. And I'm not talking about like middle and high school. I'm talking about elementary level. It has definitely increased. So this is a major problem. The first thing that I always advise my parents to do is, if you believe there's a problem, say something. Ask for a full evaluation. The school system, once you ask it and you put it in writing, they have to give you a full evaluation based on the IDEA Act. So that is a federal law that is across the states. You ask for a full evaluation of your child. A lot of the times they will be denied based on the grades of your child, but if they're emotional, if there's emotional factors that are affecting their ability to learn, then that is why you're asking for a full evaluation. From asking for a full evaluation, accommodations can be made. A 504 plan can be created, and you can also have an IEP plan, an individualized educational plan that is created or art meetings that are called, and so that you can obtain those educational rights for your child. So going back to being aware of your legal rights, you have the right to ask for a full evaluation at school. You also have the right to ask for accommodations for your child, especially if there are emotional disruptions that are occurring on a daily basis where it leads to them being put out of school. You have the right to ask for assistance with the 504 or with an IEP plan. And then maybe finding an advocate who can help you with these. There are advocates across state boards who definitely work within the school system to help parents advocate for their child and know their legal rights.
Sorry, lost my button there for a second. I did, you mentioned IDEA, and I just wanted, we do have some people here who are new to ADHD. It's the Individuals with Disabilities Education Act. Mm-hmm. And a number of people were asking about how they can pursue an evaluation, when they're perhaps not covered by Medicaid. And as you said, it is your child's legal right to to receive an evaluation for ADHD if a parent does request that. And we'll make available after this webinar some background information that Attitude has about how to request that evaluation, and just some more about your rights that might be helpful to some of the listeners on here today. And I did want to mention there's a piece in the fall issue, again, of Attitude, just right on this topic about your rights if your child is being excluded from the classroom environment, made to sit in the hallway, made to miss recess. They're telling you that you have to be in the classroom with your child to observe their behavior, anything like that. We have an article about your legal rights. So that's going to be online shortly, and we'll make that available as too, because I feel like that's also appropriate in this conversation. Knowing your legal rights is such a huge part of this battle, and not easy. It's very complicated. Let's see here. So many good questions coming in today. And let's see. Someone wrote in to say that their son has a 504 and an IEP, but they're still struggling, and they're wondering if they have, if there are any opportunities for the public school to pay for their child to attend a specialized school. That I don't know. It might be by state.
Yeah, I don't know that one.
Yeah.
I don't know that one. But what I do know is sometimes, and I'm going to just go from my experience, there have been a lot of times where a lot of my clients have not gained their accommodations. Their accommodations were not provided in the classroom, and I think that parents sometimes have to ensure that they're getting what has been provided, what was supposed to be provided for them. And so once it's in an IEP plan, the school district is supposed to provide those services to that child. And so if at your particular school, if they are not, I would say if you've already spoken with administration within the school, which is the principal, the counselor, then go ahead and call the administration. So go higher up to see what can you do about accommodations that may not be being met. Or even you can also request for another ARD meeting, if you feel like they need a little bit more. And then bring what you have, bring your evidence in play so that they are able to see how these are facts, and not you just basing it on feelings, but facts, like showing them your child's work, showing them the progress that maybe has not been made if they're still stuck in the same situation. So if they're still at last year's grade level and they should have increased their grade level by now, then bringing in all of those documents, that definitely will assist with that. But sometimes you can't just stop at that school. You have to go up another level. And then you know what? And I think y'all just did, there was just an article on this, but is that school the right school for your child? Maybe sometimes you have to stop and ask, is this the right school? And what do I need to do to maybe get my child in a better school who's going to accommodate his needs or her needs?
Mm-hmm. Yes, so much for parents to consider. Sadly, Dr. Hamilton, we are out of time today, but we so appreciate your time, insight, and expertise and your contributions to the Attitude community on this topic. Thank you so much for joining us today and for leading this conversation. Thank you to everyone who commented and listened in today. We hope you will join us for more Attitude webinars in the future. And of course, you'll join us at attitudemag.com to read our articles and research updates. We'll provide those links I mentioned, and we'll also get together with Dr. Hamilton and see. We had a lot of requests to see if there were any advocacy groups or other organizations that parents specifically could follow up with. So we'll pull those together and send them out in the post-webinar resources. So thanks everyone so much. We'll see you again soon.
Thank you. Bye.